Hey everybody, this is a video on testosterone. Some of the patients that come into my office are looking for some help with raising testosterone levels. And as an aside, I see a lot of women come in with reproductive problems, and they're complaining of, like, say, reproductive problems. You can't see my hands go all the way down, but they're kind of pointing to low abdomen area. They're saying, I have very bad menstrual cycles, I have trouble getting pregnant, trouble maintaining pregnancy. And for men, it can be, say, hey, I'm pointing down here at the testicles where testosterone is produced. And, the men, or sometimes women, have been told, hey, you've low testosterone. I wanted to share with you a secret. The problem is usually never where people are pointing. They're pointing down here and they're saying, hey, testosterone's low. Or women are pointing down here saying, hey, I'm having trouble with menstruation. Make a guess where it's coming from. I'll give you 2 seconds and then I'll announce it. The problem is usually coming from the thyroid gland. I find in my experience that the thyroid gland is the boss of so many of the other endocrine organs. Endocrine organs just means hormone-producing glands. So the thyroid is usually the boss that tells them to go, do your thing. So for men or women, but more commonly men, when there's low testosterone, it's not a problem of, hey, you don't have enough of the ingredients to produce testosterone. What is happening is that the thyroid gland is getting tired and needs some support, and it is not sending the signal to tell the testicles or ovaries or adrenal glands to make testosterone. So I usually find that if you address the thyroid gland and the things that it needs, testosterone levels start creeping back up again naturally. Medical approach will not usually go that direction because they're just saying, oh, low testosterone, here's a patch, here's a pellet, here's something that you can take that's going to give you testosterone. But that does not fix the background troubles that are going on. There may be a thyroid problem, commonly is, or you may have a nutrient deficiency, commonly is. So that nutrient deficiency doesn't get fixed, that's affecting more than one body system. So I really like to get down to the root of the cause of what's going on. Why are the testosterone levels creeping down? There's 2 herbs that also can be really nice. There's Tongkat Ali, also called longjack, and pine pollen. Both of those herbs I like to use from Lost Empire Herbs. They're a great company that I like to use. And those can, Those can fit with a nutritional program. The herbs are potent and they do raise up the levels, and I like them much better than doing the hormone replacement therapy, because the herbs and the nutrition get your body producing your hormones again, rather than your body is failing, here, let's have a hormone that you can't make. I'm a big believer that your body can make the hormones, and so let's find out what you're hungry for and get that little factory, wherever it is, most often the thyroid gland in the throat. Let's get that little factory working correctly so then it can tell the other things to go do their thing. So roundabout little idea there. But I see a lot of people come in with hormone problems that, if you dig deeply, it's the thyroid gland that is the mischief maker behind it. And sometimes there is a little bit of nutrition that's needed for the testosterone levels, most commonly zinc, and then sometimes those herbs, as I mentioned, Tongkat Ali, longjack, pine pollen. You may not have ever heard of any of these things. If you would ever like to get tested, come into my office. I'd love to see what nutritional supplements are needed for you. And if you want to call my office is 972-880-8541. Also, subscribe to this channel. I'm going to be putting out little 5-minute or so videos regularly on different health topics. So hopefully we'll get a little education without being bogged down and watching something for an hour. But these are things that I've seen and observed in my office over 20 plus years of doing nutritional work for people. And nothing better than I like to see people saying, hey, I'm feeling good again. And then I don't need to see you very often because you're feeling good and we're getting you stable. So I want to get you feeling good, and I want to have you stay there. So I want that for me too. I love to feel good and I love to stay there. I don't want it to be a roller coaster. I like it stable. So hope to meet you someday. or send me an email, drop me a line if you have some questions. I'll try to make a video if you have some ideas on questions on a video. I'll do a video to talk about it because you're not alone. Other people have those same questions. And maybe I'll meet you at the office someday if you'd like my services. Thanks for watching. I'll see you on another video.